Hello everyone and welcome to the first ever Infusio Facts vs. Myths Facebook Live broadcast where we will be debunking the myths about Lyme disease. Infusio is internationally known as the pioneers in cell therapy for Lyme disease treatment, and we have also had great success in treating other autoimmune diseases, chronic illness, and cancer. My name is Ivonne. I am a holistic health coach here at Infusio Beverly Hills, and I am also a former chronic Lyme patient, now in remission after doing cell therapy with Infusio close to 3 years ago. So I am very, very happy about that. Today we have a special guest, Dr. Suzanne Kim, who is a board certified and Lyme literate medical doctor here at Infusio Beverly Hills. Dr. Kim has been practicing medicine for 18 years and has a great experience specifically treating Lyme disease patients. And she is also an Ivy League graduate from Cornell University and med school graduate from Drexel University in Philadelphia, Pennsylvania. Prior to treating Lyme disease patients at Infusio, Dr. Kim worked at the Center for New Medicine in Irvine, California, specializing in cancer treatment and prevention. So you may also have seen Dr. Kim in the documentary series, The Truth About Cancer. Without further ado, welcome, Dr. Kim.
Thank you for having me.
Yeah, thanks for taking the time. I know you're very busy. We're really grateful you're here. So the way that facts versus myths work is I'll present a statement about Lyme disease, and Dr. Kim will set the record straight if this is a fact or a myth, and give an explanation on why. We will also be answering some of your questions on this topic during our session, so please make sure that you send us your questions in comments. So, Dr. Kim, when I was really sick in my search for treatment options and information, I found that there was just so much confusion around Lyme disease, and it just made everything so much harder for me. So I have a list of the statements that I found, and I wasn't sure whether they were truth or not. So I have these in my pocket. So can you help me to debunk those?
Sure, I'll do my best.
Great. So let's get started. Okay, so this one is the first one that I found really confusing, and that is stem cells cure Lyme.
I will have to say that's a myth.
Okay.
Okay. Stem cells have the ability to repair damage to cells, and therefore patients who have Lyme disease and there can be repair done by these cells, but we cannot say that there's an actual cure because there is no specific test that can show that the organism that causes Lyme is eradicated. The cells work by improving cell-to-cell communication and allow that repair process to happen.
Right.
So we can't say cure, but we definitely know that stem cells have the ability to repair the cells in the body and therefore allow the body to start functioning normally again.
Right, yeah. So it's actually like helping, right? The
Absolutely.
cells to communicate.
Absolutely. I just want to be careful about using the word cure.
Right, yeah,
Right.
yeah. Okay, thank you. And so we have another one, and it is Lyme disease is different in every patient. How do you feel about that one?
Yes, in fact, well, that is true.
Okay.
Lyme disease is definitely different in every patient. In fact, what we can call, we can say that it is like a unique, every tick bite is like a unique fingerprint. It contains many different pathogens, and so you can have bacteria, parasites, even viruses in one bite. So one patient may have a bite, get infected and have a couple forms of Borrelia. They could have 2 strains of Babesia. They could have some Bartonella. Another patient may have two other couple strains of Borrelia. They could have Rickettsia or Lichiosis. So there's all these different organisms that can come with one infection, and that's not going to be the same for every patient. And this is what some people call the many faces of Lyme disease. So it really can vary from person to person, and this is why patients are often misdiagnosed.
Right.
Because it looks so different in every patient.
Right.
So we really need to get away from calling it Lyme, and we use our foundational approach here, which addresses more of the, it's a broader approach. So we can really allow the body to regulate itself, and for the immune system to start functioning properly and address these broad issues that come up with when you have so many different pathogens that are involved.
Right. So this is what we call tick-borne illness, right? And
yes, and actually we do call it tick-borne illness, but to even be more broad, I would call it vector-borne illness.
Vector-borne.
The reason I say that is because actually there is evidence to show that can be transmitted not just only by ticks, but in fact other vectors such as mosquitoes. So I think vector-borne illness may even be a better term than tick-borne illness.
Right. Yeah. Thank you. Wow, that's amazing. Good information. Another one is everyone infected suffers with symptoms and will need treatment.
That is a myth. Not every patient, we know that not everyone who becomes infected with Lyme becomes symptomatic. What we do know is it seems to be, it takes what we call the perfect storm to actually develop symptoms of Lyme. And that starts with underlying genetic predisposition, and over time with epigenetic environmental influences acting on these genetic mutations that patients may have. We can have accumulation of cell damage, as well as a deterioration of communication between cells that can be accelerated, that can cause damage that is not normal, say, in most individuals who can handle this. And as a result, the symptoms can then appear. So this is very a very common scenario that we see and we're finding in our patients, is that they do have these underlying genetic variations, and this is predisposing them to becoming ill and having symptoms.
Yeah, and I think that for some of us too, the stress factor also, plays a part in there as well as part of the perfect storm, right?
Absolutely.
Yeah.
And I would say that it's, when you say stress, it could be mental, emotional, physical stress. So any type of stress on the body can kind of wear down the immune system, wear down the patient's resilience and ability to respond to properly, I guess.
Right, yeah. Another one is if I get bitten by a tick again, I need treatment again.
So that one, I would say that actually for some, yes, if you get bit again, you may need treatment. But with our approach, we use a foundational approach, which encompasses much more of the complexities that are associated with Lyme disease, and we allow, once again, the body to regulate itself, for cells to communicate again. As a result, your defense system is able to handle, more likely to handle a reinfection and ward off any invading pathogens that may have tried to enter the body.
Yeah, that totally makes sense. Totally makes sense, because if you have an immune system, the immune system is, is a healthy, strong immune system, right? Then the immune system is capable of fighting on its own, which is what it's supposed to do, correct?
Exactly.
So it's basically what we're doing is bringing the immune system back to full functionality, if you will. Right?
Correct.
Right, yeah. So another one is everyone with Lyme. Oh, I love this one. This one is like so controversial and so basic, but so important. Everyone with Lyme disease gets a telltale bullseye rash.
Okay. So that's definitely a myth. Most patients who have Lyme disease do not have a rash, and if they do have a rash, they don't have the classic rash, which is that bullseye rash that most people know about, and it's called erythema migrans. In fact, more than 50% of patients don't even recall ever having a rash. So that definitely is a myth.
Yeah, that's interesting because so true, because I remember that in my conversations with other Lyme patients, we ask each other, hey, did you have a bullseye rash?
Right.
Did you have and so many of us didn't have one, but we were still sick and infected. So yeah, definitely. So, this one is another one that is very controversial and interesting in my opinion. If the test is negative, you don't have Lyme. Please tell us how you feel about that one.
Okay. So the answer to that is a myth. So currently, the gold standard for diagnostic testing for Lyme is still the two-tiered blood test, which includes ELISA and Western blot. The ELISA is testing for antibodies against Lyme, and if that tests positive, then a Western blot is done to confirm. If ELISA is negative, then a Western blot may not even be done. So the problem with this is the ELISA has been shown to be negative in 35% of culture-proven Lyme disease. So there you've got a percentage of patients that are going to be missed. And then those who go on to do Western blot, the Western blot test also has a false negative rate as high as 50%. So again, we have a big problem when we're using these two tests.
Okay, so this one is, are we ready for this one?
I don't know, what is it?
Antibiotics cure everyone.
Well, if antibiotics cured everyone, I guess we wouldn't be here.
That's true. That is so true. That is so true.
So that is definitely a myth. So right now, if you're lucky enough to even be diagnosed with Lyme, and you say have a known tick bite, or you have the erythema migrans, the bullseye rash, then even then, and you're treated with a 30-day course of antibiotics, there's still a 40% relapse rate there. Okay, so we have a problem there, but most people are not even lucky to have either a known rash or a tick bite, so they go undiagnosed for a long period of time. So, it's some of the other issues I have with antibiotics. First, we were talking about the immune system. We know that antibiotics can destroy normal gut flora, and that can, in turn, compromise the immune system, which 70% lies along your digestive tract. So there's a big issue there with antibiotics already compromising a weakened immune system, which Lyme patients have. Another issue is that these organisms are actually smart. They can hide from antibiotics. They can hide inside your cells. They can hide inside of what's called biofilm. So there has been biofilm busters, they're called, different types. There's different biofilm busters that have been added to some of the antibiotic therapies, which have improved some of their efficacy. But still, the average time that a lot of Lyme patients have to be treated with antibiotics is 1 to 2 years, because these antibiotics can only target replicating pathogens when they're actually replicating, versus because they're not always replicating. So because of that, they're not always going to catch it all at the same time. So a lot of times patients are given long courses of antibiotics. And what we've seen in our patients is that they've already failed these long courses of antibiotics and or have been unable to tolerate the serious side effects associated with these antibiotics.
Right, yeah, especially if they are long-term, right?
Especially, yes.
Which is, I think that most cases, they continue and continue and continue to take antibiotics, most cases of Lyme, for a long time. So the gut gets more and more and more compromised.
Right, it just deteriorates the immune system even more, and then these patients become, I think, even more debilitated.
Right, yeah, yeah. So I'm going to take some questions here, you guys, and please send us our questions. We are ready to answer any questions that you may have. And I have one here from, let me put on my glasses. I'm in denial about my vision. Let's see. Effie Lakovu. Effie, I hope that I am saying your name correctly, and if I'm not, please forgive me. but she's asking something about the recovery rate using our protocols. So Effie, I will let you know that our program is a one-year program, and if you have any other questions that are more specific about the treatment, then you can go ahead and give us a call. Our number is 888-605-6579, and we will be more than happy to put you with one of our patient liaisons right away. And our patient liaisons, just to let you guys know, are also former Lyme patients who are in remission. So they know what the disease is like, they know what it does to your body, and they have all the answers to any specific questions about the treatment. And let's see.
So let me, can I also say something? Yes, okay. So what I do want to say is that we are currently under a IRB study. So we do not have any published data at this time, but we have been collecting information, and we are continuing to collect information, and that will it continually gets updated. So the last time we looked, it was about 70% improvement and about more than 50% of patients. So, but those, do keep changing because we keep adding to the database, and so that's what I would say to that question. But there is really nothing currently published at this time.
Mm-hmm. Good. Thank you. Thanks for clarifying that. Let's go on to another myth, and this one is ticks that spread Lyme. Oh, this is a good one. Ticks that spread Lyme disease only live in certain areas of the U.S. If I hear that one more time.
Right. Well, here in California, people don't even believe that there is Lyme disease.
Oh, yeah. No, I remember. I mean, I went to my dermatologist because I believe I had gotten bitten, and he said to me, oh, there is no Lyme in California.
Right.
And I'm like, whoa.
Exactly. So California, a lot of people don't even know about Lyme disease. So the answer to that is, obviously it's a myth. Lyme disease is in every state in the United States and in over 50% of the counties in the U.S. So it is continuing to grow and spread, and the reason for that is simply that many people travel these days. They can go and get infected, come back and bring it home, and then and in addition, it's also there's songbirds that are able to migrate and carry these infected ticks and spread them along their path. So we have those reasons, and it is also, there is some evidence showing that it can be transmitted sexually. There's some evidence for that. So again, people again are traveling all over, and we're just a global, the world is global now, so it's very easy. Yeah. So in fact, not just in the U.S., but worldwide, the incidence of Lyme disease is growing exponentially.
Yeah, yeah. Mm-hmm. I mean, there are things that we can't control, and that's nature, right? So
exactly.
The birds are going to do what the birds do, and we can only try to focus on us trying to take measures to protect ourselves, and also getting treatment if needed, right? Mm-hmm. So I have one question, and this one is from Ryan. Hi, Ryan. And his question is, what can a person with Lyme disease say or do to explain to family members how they feel?
Oh, that's a very good question. Mm-hmm. So one of the things that when I meet somebody, or I try to explain to someone who knows nothing about Lyme disease, there is a good documentary out there. There's some good documentaries out there. One is Under Your Skin. Mm-hmm. I'm not sure if you're familiar with that one. And there's a sequel to that as well. That's a good starting point, because it kind of discusses the issue of Lyme and why many people don't recognize it, understand it, and it takes you through the life of a patient with Lyme disease. And I think that wasn't, in fact, for me, that was an eye-opener watching that when I first started learning about Lyme disease. So I think that's a good place to start if they're willing. It is really difficult because if you live in a place where not many people know about it, understand it, or have it, then most people just think dismiss it completely.
Right.
So I would, say that would be a good place to start.
Yeah, definitely. Yeah, that is a good place to start. I agree with that. Here's another question from Sherry. And Sherry's asking, once you have Lyme disease, even when in remission, do you always have Lyme disease?
Oh, very good question. So what I will say to that is yes, because again, I don't believe that you can cure Lyme disease. And when I say cure, we're talking about getting rid of every single organism in your body. Right? That's really the definition of cure. So I do not believe that you can actually cure Lyme disease. But at the same time, with our approach, I don't think that we are aiming to cure Lyme disease. What we're aiming to do is to actually allow the body to repair itself and to start functioning normally, so then you'll be able to handle your body will just be able to function despite the fact that you have these pathogens, including Lyme, in your body.
Right.
And this is what I mentioned earlier, is that there's these genetic underlying genetic influences, and if we can allow the body to heal and then support some of those underlying genetic issues, then similar to a patient who tests positive for Lyme but is completely asymptomatic, we can hopefully make patients who currently have Lyme asymptomatic despite maybe still testing positive for Lyme.
Yeah, right. Yeah, and it all goes back to what we also were talking about before, the having the strong immune system, right?
Definitely.
So even if you are in remission and you still have Lyme disease or the pathogen, your immune system is able to, after doing the cell therapy, your immune system is totally able to tackle it on its own. And I have a question by Chelsea. Hi, Chelsea. And her question is, why is Infusio Beverly Hills so far ahead of the game? That's a good question.
Why are we so far ahead of the game? Oh, that's a very good question.
Yeah.
Well, I believe we're far ahead of the game because I've worked in my previous employment. I worked with a lot of Lyme patients, and what I found is that we were doing a lot of treatments, and these are not the typical treatments, like the antibiotics, because most of the patients I saw did not want to do antibiotics or had already done antibiotics. So we were doing a lot of treatments, hyperbaric oxygen therapy, ozone therapy, ultraviolet blood irradiation, herbal therapies, and patients were improving slowly, but it was an endless merry-go-round, where you go from one treatment to the next treatment and it stops working, and then you go into the next treatment. And what I've found with Infusio is that we have that foundational approach.
Right.
We're really trying to come in and improve the body's own ability to heal itself. And I truly believe in that. I truly believe that the body has the ability to heal itself.
Right.
And so that's what really, I think, distinguishes us from other people. Our approach is completely different. Everybody else is trying to eradicate the disease.
Yes.
And we are not trying to necessarily eradicate this disease. We are really trying to heal the body, allow it to function normally, so the body then can maintain and control that.
Right, yeah, definitely. And also we have the preparing, like we prepare the body, right?
Absolutely.
Yeah.
That's a very good point as well. So I think that there are other people out there doing similar type of stem cell therapy that we do with stromal vascular fraction that comes from fat. But again, what I think distinguishes us from maybe some of those places is that we do prep the body. We want to create an internal milieu or environment that is allows us to have a good stem cell count, as well as a good quality of cells.
Yes.
And this is what we do through our 2-week prep program. It really decreases the microbial load, it decreases the toxins in the body, and allows, again, the body to be in a healthier state, so that when we actually do the treatment, the body is able to receive that treatment. And also, if your body is in a better condition or state, those stem cells are not going to be all used up trying to go after all the different other issues that might be going on.
Yeah, right. And then there's also the mind-body medicine that we practice as well. How we have demedicalized the experience, right? Because I think that if you are in a setting that is more, how can I say, when people come to Infusio, they have been to so many doctors, right? And they've been sort of like, I don't know, I think that a lot of us have PTSD from visiting so many doctors' offices and all of that.
Oh, absolutely.
So, yeah.
Absolutely. Yeah, so we really try not to recreate that experience for patients. And so we try to create a more spa-like environment for our patients that will help them to relax and not have PTSD from maybe past experiences that were not pleasant.
Right, yeah, definitely. Let's go back to another myth, and this one is ticks. No, this one I already did. This one, oh, I love this one. A dose of antibiotic doxycycline is adequate treatment for Lyme disease.
Okay. Well, that's definitely a myth. As I discussed earlier, even a 30-day course of antibiotics can result in a 40% relapse rate. So you can imagine just one dose of doxycycline is not going to be effective. In fact, it also has been shown that it can decrease your immune response and cause the body not to produce antibodies. So after a treatment with doxycycline, it's possible to retest negative, but that could be a false negative.
Yeah, that's right. And let's take a question. This one is from, a second. This one is from Serene Porzelot. And again, if I am mispronouncing your name, I am so sorry, I apologize. But her question is, what are some of the benefits of ACT and the new home program?
Oh, okay. We're going to go into somebody who knows knows our program.
Protocol, yeah.
Yeah, so we developed the ACT, I guess they're actually, I'll address them separately if that's okay.
Okay, yes.
So the ACT we developed, and it's usually done when patients return for their 4-month follow-up visit. And we developed that to allow the body to, because usually during the first 100 days, we call that adaptive phase. The stem cells are actually replicating, and the immune system is not overactive, but it's very active. And so usually around when patients return around the 4-month mark, during that time, the immune system can sometimes take a little bit of just not a dip, but just come, settle down a bit. So I think it's a good time to kind of give patients a little boost and allow the immune system to have an extra. Look at the camera here. I'm getting the eye. Allow the body's immune system to be strengthened once again during this time. As far as the home program goes, the home program is really designed and developed in this past year. And this is in response to the feedback that we're getting from our patients. We really listened to the patients and what they were going through and some of the issues that were coming up. So what we found is that there is actually a process that's happening during neuro repair. And there's and I know that Phil has discussed this in some of his other talks, but there is a process called Wallerian degeneration, in which when a nerve is damaged, there's an increased production of mast cells tenfold, and as a result, we can have high levels of histamine being produced. So that's one of the things that we wanted to address because if you have high levels of histamine, that can result in issues, including leaky gut when you have high histamine levels. And as I mentioned earlier about genetic influences, many of our patients have underlying genetic issues with breaking down histamine. So if you put that together, you can have heightened issues that you can imagine. And this kind of was an explanation of why we saw patients coming back and having having increased issues with their gut. So we realized that this is the process that's happening.
Right.
And not just gut. It could be skin rashes. It can also manifest as worsening allergies and neurological issues. So it's actually a whole host of issues that can happen. But this is in response to what we saw was happening in patients. And there's some other underlying genetic issues that we've discovered that a lot of the patients have. So we're trying to address those because they can increase inflammation in the body. And so we want to make sure that we help patients with that issue as well.
Right, yeah. So it sounds to me like a complete approach.
Absolutely. And we're continuing to learn, and we're continuing to modify the program as we see fit.
Yes.
So we're definitely open, and we're just always looking to help patients and improve the experience for people.
Yeah, new medicine is now.
Absolutely.
So here's another one. If the patient doesn't look sick, they can't have Lyme disease. I cannot tell you how many times people, when I was really, really sick, people would say, "Oh, but you look great," and that is something that's very common on Lyme patients.
Absolutely.
That we look okay, but really inside,
okay, well, you answered my question.
No, but I want to hear it from the, from the authority. I want to hear it from you.
Yeah, so it's a myth. So as with many chronic illnesses, you can be very ill, but look outwardly healthy. So it's definitely a myth, and unfortunately, you can definitely look just because you have. Okay, sorry. Let me start again. So, for example, fatigue and neurological or brain symptoms may not necessarily appear physically.
Right.
Right. So patients look normal, and as a result, they're misunderstood often by family, friends, even their own physicians, who say that they're either crazy or they're just tired, they're stressed, they're depressed, and they're often then put on all sorts of medications. And unfortunately, many times laboratory and diagnostic testing does not show anything definitive. So that's why a lot of these patients are told there's nothing wrong with you.
Right. Yeah, because it's not something like Lyme disease is not something like, let's say, when you have a disease like rheumatoid arthritis, where you can see physically that your fingers are looking different, your anatomy changes, so you can see it. But with Lyme patients, it's more, it's not so obvious, even though it can get to that point, because there's a lot of Lyme patients who are on wheelchairs, and they lose the ability to support their bodies and walk and things like that. So
yes, many of our patients are bedbound, and as you mentioned, they're in wheelchairs. So it really is a disease that can affect patients very much. At the same time, if you look at them, they don't look like they should be in bed or in a wheelchair.
Yeah, no, and I really think that Lyme patients we're pushers. Like, we really push through,
Oh, like absolutely.
We
type
totally,
A.
Yeah.
Type A.
Yeah, so we push through, and we seem to be okay when we're really not. Let's see, let's take another question. And this one is from Barbara Cohen. Hi, Barbara. And
Hi,
she's
Barbara.
asking, how does the therapy deal with neurological symptoms?
So neurological symptoms, I'm going to assume that she's speaking specifically to issues relating to the brain.
Right.
The way I say that is because actually a lot of symptoms can be neurological, I mean, based because of nerve damage.
Right.
But as I mentioned earlier, the stem cells have the ability to repair damage. So they're able to repair nerve damage. And and that happens a little bit further down because it does take time for the body to, it has to break down the damaged cells before it can rebuild the new cells. But it does have the ability, specifically the mesenchymal stem cells have been shown to be able to become new nerve cells. So in that way, the damage that's been done, which is usually the case with neurological symptoms, but also with any other symptom, a lot of times it's damage to the nerves.
Right. Yeah. I know that there are some people who call neurological symptoms things like brain fog and stuff like that. Do we have another? So I can look at my questions. Just 1 second here. So let's go into another myth. This one is Lyme disease isn't that serious.
Okay, well, that's definitely a myth. So Lyme disease is very serious. We know that Lyme can affect almost every organ in the body, and when it infects the heart, it can cause an inflammation, such as carditis or pericarditis. And this is very serious because this can actually result in cardiac arrest and death. So in addition, I think that the chronic nature of Lyme disease results in many patients, unfortunately, committing suicide. So it's a really very serious disease in that respect as well.
Yeah, definitely. It can be fatal. There is also a mental component as well.
Absolutely, because when you're sick and you know that there's something wrong with you and nobody believes you, and you don't want to be sick, it really can cause you to become depressed. The illness itself can also cause changes, in the brain and changes with release of neurotransmitters. So, that can cause depression. So if you put those together, it can really heighten what's already being caused, possibly symptoms being caused by the disease itself, and then just the being in that sick role for so long.
Yeah, it can get pretty intense. It can get pretty hard.
Absolutely.
I know that for me it was, but I consider myself lucky and very grateful that I had the support that I had, because that really helped me getting through. And that's another thing too that I think is great to have support, have a support system. After you do your treatment, have a support system, somebody that you can reach out to. Whatever that looks like to you, so that this person can help you if you're feeling, down or depressed or anything like that. It's really important. Let's see how we can. How can we? Oh, this is Denise. Hi, Denise. Denise is saying, how can we talk to our integrative doctors about Infusio's stem cell treatment program? Many have a lot of skepticism, and as we are working with them post-stem. How can we talk to our integrative doctors about Infusio stem cell therapy?
So, hi, Denise. So I think that, we do have information online, and I know that if when I was working with patients, and patients would tell me about treatment or therapy, I would go ahead and investigate that myself. So it would be nice if they could do that, but I understand that's not always feasible for doctors. They have time constraints. So we do have that information, and that's something that maybe you could provide that with your doctor. But we are trying to develop some relationships with doctors out there who are interested in our therapy so that they can better understand what we do and how to support their patients who've gone through our program. So we're in the process of developing that right now, I would say.
Great. Thank you, Dr. Kim. And let's see, we have another one, and it is Lyme disease isn't that serious. This is our last.
Oh, wait.
Did we already do that?
I think you did that one.
Oh, okay.
That's
so
okay.
Let's see. Oh, wait. Is it all Lyme disease patients have the same symptoms? Did we talk about that one too? I think I lost my place here. All Lyme disease patients have the same symptoms. Yeah, we did talk about that, right?
All Lyme disease have the same symptoms.
Well, we can talk about
no,
it
we
again.
Didn't. No, I don't. No, we do not.
Okay.
That. Yeah,
okay.
That's a good
Yeah, so all Lyme disease patients have the same symptoms. How do you feel about that?
Definitely a myth.
Yeah.
So we discussed earlier about how, it's like when you get bit, it's like a unique fingerprint with the organisms and pathogens that you can get. So as a result, similarly with the symptoms, we have, most patients have over a dozen symptoms, but we'll find that there's not one symptom that every Lyme patient has. Does that make sense?
Yes, totally.
Right. So these symptoms can include anything from fatigue to headache to muscle pain, nerve pain, joint pain, gut issues, neuropathy, I think, and just to name a few. It can really affect every organ in the body. So not everybody has every symptom, but again, the variety and the combination of these symptoms is just different for every person.
Yeah.
So it really is unique.
Yeah, definitely. That's another thing too. When you have conversations with other Lyme patients and you start comparing symptoms, it's like, oh, I have that one. Oh, but I didn't have this one. Oh, but I have that other one. Do you have this one? So not everybody.
And I think this is the reason why patients don't get diagnosed, because it looks so different.
Yeah.
And we talked about the many different phases of Lyme disease earlier as well. So again, it looks and appears different in everyone, and unfortunately, due to this, patients really can go for long periods of time and do go for years and years without being diagnosed.
Right. Yeah.
Or have misdiagnosed, I should say.
Yeah, definitely. I agree. So let's see. Do we have time for one more question? Okay. So
One more
we're going to take one more question.
Okay, one more question.
One more question. Okay, good. So being sick, this is Chelsea Hope. Hi, Chelsea. Being sick with Lyme and mold mycotoxins, is it important to treat mold first before stem cell therapy?
It is not necessary to treat mold before stem cell therapy. What we found in our experience is that there is a certain genetic predisposition, again, when I was talking about that, that patients can have to being sensitive to mold. So while we can't change genetics, what we can do is, and what we found with the treatment is that it can decrease the level of sensitivity that patients may have to mold. So we don't tell patients that you have to, treat that before you come.
Right.
Because you can actually, our treatment will help decrease your sensitivity to the mold.
Right. So there is not necessarily a pre-treatment to the treatment. So all
Exactly.
you have to do is come here and we'll take care of everything.
Absolutely.
All right. So that was our last question. And Dr. Kim, thank you so much for being with us. I know that you are very busy doing things and with the ACT and preparing the patients for the stromal vascular fraction and all of that. So thank you so much for being here with us.
Thank you so much for having me.
Definitely. And so I think we have another event coming up, right? Yeah, that was so much information. But anyway, so a lot of valuable information. Dr. Kim, thank you so much. And you guys, this is a wrap on today's broadcast. And thank you to everyone who asked questions and participated. And like I was saying, our next Facts versus Myths will be on gut health and the immune system on Thursday, July 26th. So be sure to sign up and set yourself a reminder so you don't miss out on all of this goodness. And remember to follow us on Instagram and Facebook at Infusio Beverly Hills, and sign up too at the link in the caption. That way you won't be missing out on any news and recipes and inspirational messages, and as well as helpful tips and information on Lyme disease and cell therapy treatments. And also follow me at Oh Naturally on Instagram and Facebook. And again, thank you so much for tuning in, and we'll see you next time when we expose the truth about your gut and how it can potentially harm or help your body. Until then, guys, see you next time. Be well. Bye-bye.